Should be live any second now.
Thank you and good evening, everybody. My name's Councillor Julian Bell. I'm the Chair of the Health and Wellbeing Board and would like to warmly welcome you all to this evening's meeting and welcome members of the public as well who are watching live, and also I think we've got some of them on this Zoom meeting who will be asking questions later. Apologies for absence. Have we had any apologies?
I believe Sarah Rushton isn't able to attend.
Okay, thank you. Any other apologies that anybody's aware of or want to give? Fine. Urgent matters, I'm not aware of any. Declarations of interest? No. Matters.
Sorry, Julian, I'm having problems because I can't work out how to raise a hand on Zoom, but it's Jo Manley here. Just to be clear, I'm representing Sarah today. Sarah Rushton, just so you know. Sorry about that.
Yeah, thank you, Jo. And yeah, we'll put something in the chat if you have a problem. I've got in the chat that you're having a problem hearing things, Binder. Is that an old comment, and can you now hear? We can't hear you, Binder, but hopefully you can hear us. All right. Well, anyway, let's get started. Hopefully, people can hear and will be able to take part. And I will look out for hands that people put up. If you go to the participants icon and click on that, it lists all the people in the meeting, and then there's a raise hand icon on the bottom left of that list of participants. So I will look out for any raised hands as we go through. So first item on the agenda of real note is item 6, minutes of our meeting held on the 28th of January. Can we agree those as a correct record?
Great.
Thank you
Chair,
very much. Yeah.
Chair, there is one correction, I'm afraid. I identified Ealing Save Our Hospitals incorrectly. It should be Ealing Save Our NHS. So correct. I will make that correction. Apologies.
Yeah, well, I think that was my mistake, which is a very serious omission crime on my part, because I should know better than that. So apologies, Eve. I don't know. It's the effects of COVID, I think, something, and the lockdown. But yeah, we'll make that change, and then we'll agree those as accurate and correct. Thank you very much. Let's now go on to item 7, which is the Healthwatch Ealing Q3 patient experience.
Perfect. Thank you very much, Councillor. If it's okay, I'd just like to share my screen, and it's the same as last time, a quick presentation. There we go. See, that means I can't see my notes, so I might just leave it like that. So as well as the patient experience report, I wanted to provide a couple of updates on what else we've been doing over the past few months. So I'll get to that at the end. But just to give you an overview of what the Q3 patient experience report showed. Can everyone see this okay, or is it a bit small?
It's a bit small, Matt. If you could put it on slides, slideshow would be easier.
I'll try and remember the notes I took.
Yeah, that's better.
Yeah. Okay. Perfect.
Much better.
So, as you can see, there was a small increase in the number of reviews we received for Q3. So it was up 88 reviews in total. The majority of which were positive, and the table on the right shows the breakdown of what specific service categories received the majority of positive reviews. And you can also kind of get a feel for where the majority of negative reviews are coming from. One point to note is, while the majority of reviews were positive, the star ratings from 1 to 3 made up at least 25% of the reviews received in October and November. So there's clearly issues and room for improvement that need to be taken note of, and hopefully this report sheds some light on them. So moving on to GP services and the reviews for them. Overall, the experience that patients received was positive, receiving 75%, so 3/4 had a positive experience. However, there were obviously some negatives, as we can see from the figure on the right. The sub-themes of waiting times and patient choice were responsible for large proportions of negative feedback. So obviously this is pertaining to the availability of appointments that suited the patient, as well as the amount of time that patients had for appointments when they did receive them. The other area of concern is relating to staff, in which the reviews for staff were almost half and half, so 49% were negative for staff at GP services. While you view this in conjunction with the fourth bullet point, that people were largely positive about the providers themselves and the management of service, this means we can pinpoint the source of negativity being staff members at GP services. We did some further analysis and identified that this is significantly increased during the pandemic compared to prior to the pandemic. So this could be an indication of the kind of stress and the pressure that the pandemic's caused on members of staff, but also the impact that it's had on patients as well. So these two could contribute to the negative reviews we're seeing here. And obviously this needs further investigation for when we start to come out of lockdown to see if these things ease. But this does form a recommendation that we'll come to later. Next, we have reviews for Ealing Hospital, and there were no significant areas of concern, although a little caveat to that is that we only received 90 patients' feedback compared to 224 from last quarter. So of these 90, the ones that reviewed staff or mentioned staff in their reviews, 98% of them were positive, referring to their friendly nature, professionalism, and overall competency. This is a trend that we've seen throughout the pandemic. So this is really, really lovely and really exciting to be able to present on this kind of feedback. Treatment and care also followed a similar pattern, but was actually an emerging trend. So we hadn't seen this one previously. But 93% of the reviews for treatment and care were positive. And then finally, access to services was the highest applied theme. Sorry, suitability of provider was the highest applied sub-theme of access to services during this quarter. The other services we received reviews for were predominantly dentists, pharmacies, and opticians. As you can see here, 82% of the reviews we received for dentists were positive. However, this doesn't take into account the people who are finding it a real struggle to get access to dentists during this time. This only identifies the experiences of people that have had access to dentists. And we're receiving a lot of calls at the moment indicating that people on the whole aren't receiving the care that they need from dentists. So this is not entirely representative of the service category. For pharmacies, the reviews were largely positive, with many citing the delivery of prescriptions as a useful and beneficial piece of support for them. And although there weren't many reviews for communication for pharmacies, it was quite evenly split between positive and negative sentiment. So communication could be seen as an area of improvement, and I suspect that this is the same issue that we're seeing for staff in GP services, that the kind of pressures and the strain that the service and the patients are feeling may contribute to this. And then finally, out of the total number of reviews for opticians, 87% were positive in sentiment. So coming on to the recommendations and the next steps for this Q3 report, on the left you'll see in black are the 4 kind of next steps that we're taking and that we're currently taking. And then the 4 recommendations on the right are ones where we'd need some stakeholder collaboration to understand how we can best action them. So on the left, we're using our patient experience programs to further understand attitudes towards vaccinations. We're doing this in conjunction with the webinars that we're currently conducting with Hounslow and Hammersmith and Fulham. So we'll piece together all of this data and all of this information and produce a report out of that very soon. We'll continue to improve feedback rates from BAME communities. There was an increase in the representation of BAME communities in this report, with only 48% of the feedback coming from white participants, whereas it's usually in the 60s. So this has improved, but we need to improve it further, and particularly capture the feedback from people of Polish nationality and other Eastern European nationalities. Your Voice as an organisation are conducting reviews of other services across their boroughs, and we can segment this down to an Ealing perspective. So shortly we'll be able to produce 2 reports, one on patient experience of pharmacies and one of patient experience of dentists during Q3. So that's to come next quarter. And then finally, we would like to look to do more of an in-depth analysis of the patient experience data that we've got over the course of the pandemic, to understand if there's any variation in experience of different ethnicities or different wards during this time. Moving on to the recommendations for collaboration, we would like to restart discussions with stakeholders to explore how we can ensure that our findings are being acted upon. So this would be really useful to start to have discussions when the pressures of the vaccination rollout begin to ease. 2 recommendations directly for GP practices in Ealing is to ensure that patients experience continuity in the GPs that sees them, as this has regularly come up in this Q3 report as an issue. And then point 3, work to improve the consistency in appointment follow-up and proactive communications, with a lot of patients feeling like the burden of responsibility was on them to chase up their GP during this time. And then finally, we'd like to explore the ways in which we can improve feedback on staff at GP practices that receive a significant proportion of negative reviews. We actually did a bit of further analysis on the GP feedback and found that it was specific clusters of GPs that were receiving the significant proportion of negative feedback for staff members. So one idea was, if we were able to work with the CCG, we could kind of highlight what these GP practices are, and then understand in more detail how we could support staff at those practices, and maybe share best practices from other GP services in the borough to help them further improve their service. That's the end of the Q3 report, and then just some other updates from us. So the Q4 report, we continue to improve our review numbers. It's approximately 1,300, so that's over 200 increase again. And then hopefully next Q1, we'll get to conduct some face-to-face engagement. We've produced and sent on the 2-year GP access review. So I believe that will be reviewed soon. And we're also producing next month the 2-year Ealing Hospital review of access to services. And again, both of these can be circulated when they're approved. As I mentioned before, Your Voice are producing patient experience pharmacy and dentist reports for Q3. And it would be good to share this with everyone and then understand how you'd be using these reports, whether they're useful, whether we should keep producing them, whether you'd like an annual report just to see how the trends evolve over time. We have our Healthwatch England and NHS improvement project that's going to be submitted by tomorrow, which looks at how services for women with multiple health conditions are currently being supported in the borough. So this is one that I'm really excited to present to the Integrated Care Partnership Board, because it uncovers a lot of issues in terms of holistic care pathways, coordination, and the kind of general report that this cohort's receiving. The Healthwatch England have produced a report that largely echoes what we found in this Q3 report. So similar kind of issues are happening on a national scale. And then finally, as I mentioned earlier, we continue our webinars, and hopefully we can conduct some face-to-face engagement soon. And this will include interim views for mental health hostels and in the future care homes again as well. And that's everything. So if there were any questions or comments, please do let me know.
Thank you, Matthew. You're going to stop sharing your screen now so that I can
do, yeah.
Pick up and see everybody and see who wants to come in.
There we go.
So I can't see any hands raised. You can wave at me as well if you can't find the hand.
Oh, Kerry.
Kerry, go ahead, Kerry.
Thank you, Chair. We're doing some work, or propose to do some work with Healthwatch around the Lost, Forgotten, Abandoned report, which is looking at the impact of COVID on people with disabilities. And I think maybe that would be something like back to the Health and Wellbeing Board when we've done some local
Yep, that certainly would be something that we would want to look at, Kerry. Higher incidence in that of COVID in that cohort, so very much so. We've lost you. I think you've frozen, but we got the gist of what you were saying, Mahini.
Hi, thank you, Julian, thank you. This is really helpful. What I think would be quite helpful as well is as we come out of the pandemic, and clearly the way services are going to be accessed by people and being delivered, a lot of it will be, part of it will be virtual, part will be telephone, part will be face-to-face, that we find, the Healthwatch finds, I shouldn't use the word innovative, but new ways of how we report that, so we make sure that we understand the populations who can be potentially digitally excluded, and all of us recognize that as an issue. and whether there are pockets and what we can do with it. So I think because things are going to be different. In many ways, not just in GP surgery, whether it's outpatients, it is going to be different. So I think we do need to make sure that we capture it.
Yeah, definitely.
Yep, no, that's a very good point, and I'm sure that we will all evolve into this kind of new world that we're in. Digital exclusion, I think, is something that we do need to focus on. So thank you, Mahini. Any other comments or questions at all from anyone? In terms of your question, Matthew, on your last slide about how regularly we might want to see the pharmacy and what was the other one? I can't.
The dentist.
Yeah, I think an annual report would probably be would be the best way of doing it. Otherwise, we do. I think we do value the quarterlies on the kind of big ticket items. Not that they aren't, but certainly I think annually would probably work.
Yeah.
I know that also we did, having read the minutes from our last meeting, we did talk about this issue of GP staff and so in that sense, I think anything that we could do in order to collaborate around looking at that more closely to find out what's behind it and what can be done to improve that. And to be honest, I think we pretty much said that last time as well. So that's probably why health partners are not commenting, because we kind of agreed that was the way forward. Neha, you wanted to come in? Was it on this?
Yes, thank you. So I think this is really helpful, and we need to take it to our local primary care committee, as we would normally do, to discuss what next with this. And I think some of your ideas around, so there is some more detail that we obviously need to go through about the clusters, about where these issues are emerging, and is there a particular a set of practices, or which practices did you see this quarter? Because I know you don't speak to all of the practices every quarter, and what's the impact of COVID? There is so much to unpick in what you've presented today, and the impact that is having on patient experience, and we need to understand that further. And I expect during Q4, with the lockdown that we've had, I'm not sure whether we would see much of an improvement for Q4, or maybe there will be, depending on which practices you've spoken to. So
yeah,
there is a lot of work in that can be taken from this, and I'd really like to, as a local team, understand a bit more of the detail to then have some very tangible actions.
Sure. Well, from our side, I can definitely look into how we can pick apart the data a bit more. And as you said, because there is that variation, we do have to be quite careful in interpreting it and understanding that not every GP surgery is represented in the report through this direct contact, obviously. Yeah.
And sorry, if I could just add one other thing. I mean,
Go ahead.
Everyone has, thank you. Everyone's been working so hard, so there is we've got to be careful that this doesn't demoralize staff that have been working so hard in all settings of care, and there is just, we need to put it all into context, I would say.
That's a really good point. Yeah.
Mahini?
Yeah, actually, I should have picked that up, and thank you, Neha, for flagging that. I think that's a really important point. I think it's the same staff who are working in GP surgeries, who are the people who are living in the community, who have had family members and their communities affected by COVID. So I think that's really quite important, actually, Celia, and they have a very important point.
Okay, so we'll obviously pick this up at our next meeting and see what's happened in that last fourth quarter as well, and see any changes there may be as we come out of lockdown. So I think that covers that item. So thank you, Matthew, for all your hard work and your team on this. We look forward to your next report next time. Can we move on now to our Ealing update, which is on COVID, and Anna Bryden, our Public Health Director for Ealing, is going to lead on this. So over to you, Anna.
Thank you, Chair. I hope you can hear me. I'm just going to try and share my screen.
Yep, we can see that.
Okay, great, thank you. So good evening, everyone. I'm Anna Bryden, Director of Public Health at the Council. Just going to run through my usual COVID update slides. Just to be clear on the agenda, this is down as Ealing update, so this is the usual COVID update. We have published on the website under the agenda a couple of documents that relate to the Outbreak Management Plan, which I'm not going to run through in detail, but they are included as a summary within my slides, but they're there to be published, and so people can look at them in their own time, just for information. So just running through, I'm going to go through the usual order, so covering the situation both nationally and at Ealing level, going through those key programme and service areas, update on care homes, update on the impact assessment that we've talked about this board recently in terms of inequalities, and we'll come back with a more substantial item on this next time. And then, as I mentioned, the Outbreak Management Plan. So I'm sure a lot of you will have seen this in the media at a national level. I think the easiest thing here is just to look at the small graphs on the bottom. The first three are about the number of people who test positive, deaths within 28 days of a positive test, and the number of people going into hospital. You can see obviously that very large peak in January and early February that has really gone down low nationally. Also on the right hand side, I think importantly, the number of tests that are being conducted has actually gone the other way. So the government has a very clear strategy about trying to increase the number of people that are tested. So that's both those with symptoms, but especially for people without symptoms to do regular testing. And one of the biggest increases in that has been in terms of schools. They are asking students and school staff and their families to get tested twice a week as well. So you can see those numbers have really shot up in the last month. Chair, I'm just keeping my video off just so the signal doesn't disappear, so apologies. In terms of that national position, you will all be aware the government's put out their roadmap for how we can exit lockdown. They're calling it a kind of cautious and irreversible strategy. So that's looking at easing the restrictions in steps across the whole country and being data driven within that. So on the right hand side, this lists out the 4 tests that the government is using to ease those restrictions in stages. So for example, that the infection rates aren't causing a surge in hospitalisations, and that the vaccine programme carries on being rolled out successfully. I think really importantly for everybody, those dates that I'll give in a minute are indicative and are subject to change, and each of those stages has this 5-week review period between each step to see how things are going. What's the impact, especially on infection rates and hospitalisations, and does it feel safe to go through that next stage? And government's going to give a week's notice about those restrictions. So step 1, we've already had, so 8th of March, where the main thing was that schools and education facilities opened. 29th of March, yesterday, the biggest change was about the rule of 6 came back in for outdoors, so people can meet up to 5 other people from any number of households. but no household mixing indoors. And obviously linked to that, some of the outdoor activities have been reopened. So for example, outdoor sports. Step 2, which we're expecting on 12th of April, waiting to see if that date is confirmed. The main changes at that point are more around outdoor attractions, so things like outdoor hospitality, pub gardens, zoos, that kind of thing will be reopening. Some of the library and community centres, and also all retail will be reopened, including the non-essential retail. Step 3, which is at the earliest 17th of May, I think the biggest change there for a lot of people will be that either rule of 6 or 2 households can then meet indoors, which obviously will open things up socially for a lot of people, seeing their family and friends they haven't seen for a very long time. And they're going to start trying out some of the large events, so for example sports events, and some travel will be allowed at that point, subject to review. Step 4, which I think is the one everybody's waiting in anticipation for, is when a lot of, well, all of the restrictions should be lifted. So no legal limits on social contact, etc., and all of the settings open, obviously very much subject to review at that stage. I think the government's hope is that the timeline will be stuck to and will actually roll out as they've envisaged. But I think there is also an expectation that there will be potentially a little bit of a rocky time during late spring and early summer in terms of potential outbreaks in settings such as schools and workplaces. So we will have to see. So looking at Ealing, you can see the similar graph at the bottom as has happened nationally. We saw a very big increase in rates in January and early February, and then a very sharp decrease. We're now at a similar level to what we were seeing in about October. So we're seeing about 200 residents every week testing positive. So we've now got an infection rate of 52 per 100,000, which is similar to the national level, but is still 5th highest in London at the moment. And this graph, apologies, when I reviewed it earlier, it does look a bit all over the place. This is showing our towns across Ealing, so the 7 towns. I think the 2 key points for me is that Southall and also Greenford and Northolt have been particularly high all the way through the pandemic. So you can see over on the left side, the orange and the yellow lines were high, and they've really come down in the last few weeks, which is really reassuring. At the same time, in the last week, we are seeing a slightly unexpected rise in Ealing, particularly at Acton. So we are seeing how that goes over the next week or so, and really looking at where are those infection rates coming from? Are they linked to any particular settings? And look at the learning that we've taken from the reductions in the other areas. In terms of deaths, you can see the similar graph to what's been happening at a national level. We did sadly see that very sharp increase in deaths in January and early February. And so overall, across the whole pandemic, we've now seen just over 800 people, 800 residents sadly die from illnesses related to COVID. You are now seeing, though, in that graph that has gone very low now. So we had 6 COVID-related deaths in the latest week of data, and that's similar to England. Just briefly, in terms of outbreaks, you can see if you were here at the last couple of meetings, the numbers here have really gone down. So at one point we were seeing quite a few numbers of outbreaks, especially in schools, care homes, and workplaces. We're now seeing very small numbers, and I think really reassuringly, we aren't seeing any facilities, including care homes, closed apart from one early year setting. So that's a real big change when we look back into the autumn and winter. So just going to go now to share through some of the key programme areas. When I was looking back at when we last had the Health and Wellbeing Board was late January, it actually feels like a long time ago in terms of some of these. There's been a lot happening. Testing, so just to remind people, if people have got symptoms, we've got 3 local testing sites. People can also order home testing kits, or they can go to sites in local boroughs, so for example Heathrow, so that's all still in place. For people without symptoms, there's been an awful lot of work on this over the last 3 or 4 months. Our community testing programme is for us to encourage people who have to be out and about. That might be for work, it might be for the essential trips like shopping. We are trying to encourage people to get tested twice a week with the rapid tests that give you results within about half an hour. We've got 6 large testing sites dotted around the borough, and we're also currently piloting testing within 12 pharmacies, which is great. And as you can see from this, we've tested almost 50,000 people so far, which is amazing, and had just over 600 people testing positive. And I think really importantly for me, even though those numbers might sound low, that is the kind of level that you would expect anyway across the population, and that 600 people that otherwise wouldn't have been asked to self-isolate, wouldn't have, would have potentially been out there transmitting the virus to people without knowing. And so I think this is really a positive programme. I think one thing that is going to come a long way and change the environment around this is what we're calling the Community Collect programme. So at the moment, if people want to get one of these tests for people without symptoms, they have to go along to a test site. The government has expanded that recently for people who are linked to schools and nurseries. So they might be parents of children, or they might be workers in those settings, that they can actually either pick up or order online tests that they can do themselves at home, which obviously is a lot easier for people and a lot more a lot simpler to do and a lot more accessible. There is an aim that the government will soon open this up to most adults, and that will be a really good step, but we are just waiting for that policy to be changed. And one of the big things that's happened since we were last at this board is some work around the South African variant. So this is a variant that was found. We had one person in the Hanwell, West Ealing area back in February who was identified as tested positive for COVID. And then when they did some further specialist analysis, was found to have the South African variant. This is a variant that's similar to what's now known as the Kent variant. It is more infectious than the original variant that was in the UK. It's not more. It's not any more serious. It doesn't cause any more hospitalisations or deaths. But because it was very new in the UK, the government worked with a small number of boroughs across the country, including Ealing, to try and find out more about this virus. And see how it was being spread. So we had somebody in that area who tested positive with the variant who hadn't had any clear travel history. So the government really wanted to work with us to see what was happening there and what was spread out in the community. We did a large amount of testing over a 2-week period in February for people without symptoms. So we had a mobile testing unit in the Dean Gardens car park. And we also used some local teams to go and do some door-to-door knocking and offer tests that were collected a couple of hours later. We had almost 9,000 people carried out those tests, which is fabulous. So real big thank you to everybody who worked with us on that. And I think reassuringly for us, we found about 100 people out of that 9,000 with COVID, which is really what you'd expect to find. But we didn't find any other South African variant cases in that surge testing area. So that was really reassuring. However, over the next few weeks, we did identify a number of other people dotted around the borough who did have the South African variant, and again, with no travel history. So again, working with our colleagues at regional and national teams, we tried to carry out a much broader programme of enhanced testing across the borough, really focusing on those communities with higher prevalence anyway, really trying to drive down some of those inequalities. And really just trying to support people to get tested generally when they were out and about. So we had 2 additional units for people with symptoms, so 2,500 tests carried out, which is great. And again, we had a roving unit and some door-to-door testing for people without symptoms, and had over 5,000 tests. So we're just waiting for the data to come back from those. and we'll share that when we've got it. And if anybody's interested, we've been published as a case study by a local government association about lessons learned. So just moving on to some of our core service areas, contact tracing has been running for over 4 months now. That's going really well. I think one important point is that when we were having the large surge in infections in January and February, that team was dealing with about 120 cases a day compared to about 30 before Christmas. So they really were busy. And they are successfully reaching about half of people they contact, which is great. So we've had about 1,800 residents who have been contacted through our local service who otherwise wouldn't have been. So again, asked to self-isolate and pass on details of people they've been in contact with. And our overall contact tracing rates have really increased over the last couple of months, and we are now 8th in London on that. That team, because they've been trained up and they're talking to local residents, they've also been contributing further to the response. So, for example, recently they've been calling up groups of homeless people staying at temporary accommodation, encouraging them and informing them about some of the pop-up vaccination clinics, and that's been really successful as well. We also will be piloting a new approach soon for that team, whereby any Ealing residents who test positive, the details will be passed directly to our local team rather than through our national team. And that we all the positives of having a local team in terms of knowing the area, being more trusted, speaking local languages, they will really come through because they'll start talking to people on day one rather than waiting a couple of days and seeing if the national team can talk to them. So just moving on to vaccinations, Neha is here as well, so if there's any questions afterwards, I'm sure she'll be happy to answer some. Just to say, in terms of delivery, we've had 140,000 doses of vaccine delivered up until this week in Ealing, which is absolutely amazing. I remember a couple of weeks ago when that passed 100,000, I think everyone was absolutely delighted. We are now carrying out second doses at the sites run by our primary care colleagues, and that will be at about 11 to 12 weeks after people have received the first vaccine. For everybody in those top 9 priority groups that have been identified nationally, so that's anybody over 50, anybody with a long-term condition, health and care staff and carers. The national booking system is available for people to book directly, or they can call 119 if they haven't yet gone for their vaccine. So we really are trying to encourage as many people as possible in those groups to get vaccinated. And locally in Ealing, we also have CP House, which is on the Uxbridge Road in central Ealing, which is one of our big vaccination centres, as well as 6 pharmacies dotted around the borough. And also people in Ealing can access other sites in northwest London. There's an awful lot of work going on in terms of inequalities and communications and engagement. We are seeing lower uptake in some of our communities in Ealing. So, for example, in Northolt, Acton and Southall, and that's particularly among people from Black or Black British backgrounds. We are doing a lot of work with particular communities. So, for example, there's a webinar with Somali community members this week and staff webinars as well. We are also looking at how we can work together across local partners to try and carry out vaccinations for people who are unregistered and might be worrying about coming along in terms of passing on their personal data. We are carrying out, we are developing local borough plans, so very closely between the NHS and council in terms of targeting those populations that are less able or less willing to go to some of the vaccination sites. So, for example, looking at carrying out vaccinations in faith settings. And we're doing an awful lot of work. So, for example, training up community advocates.
I turn this off, sweetheart. The whole thing. I'm messing it up. I need the whole thing.
Can people mute their microphones, please?
Finally put a face to the name.
We can hear some background noise.
Oh,
Better.
there we go. Thank you, Chair. Just moving on to an update in care homes. Again, Kerry is with us, so if there's any questions, he can support as well. We have got a large number of registered care home beds in London, and we have been doing a huge amount of work over the last year in terms of having an infrastructure across local partners to really support care homes throughout this pandemic. So they have a regular care home cell that really provides oversight of what's going on in that system, what advice can be given, and oversight of any issues. I think it is important to note that the group doesn't have any direct powers to close care homes, but can offer advice and information, and has direct fortnightly meetings with managers. We have got significant voids in the sector, and there is a market oversight group that's meeting to look at any risks and of potential home closures. I think really positive for everybody that at the moment, in the last couple of weeks, there's been no recommended care home closures to new admissions, which is fantastic. 3 care homes have continued to impose their own closures, but they're not for public health reasons. And I think really positive that at the moment we've got about 89% of care home residents have received their vaccine, and about 2/3 of care home staff, and half of home care staff. So there is still obviously work to do, especially in terms of staff, but it's really great news. So just moving on to the last couple of slides. This one's really for people to read and take away. We have been doing a huge amount of local work looking at what are the impacts of COVID, and especially on inequalities. So really understanding that, and with the aim to come out with some recommendations across all of our local partners that we can own together, and really will help drive down inequality over the next few years. So we've been doing looking at data analysis. So for example, infections, illnesses, deaths, and splitting that across different risk groups. And I think we presented on that a few months ago. We are updating that now with analysis from the second wave, because it feels quite out of date now. And I think really importantly, there's been an awful lot of community engagement and consultation work around inequalities as well. So really trying to listen to what the community is saying the impact has been, and what the community feels can be changed, and we can work on together. So we are hoping to take that forward in the next few months, and we will come, Chair, if it's okay, to the next board with a more substantial item on this. And I think the plan is that hopefully those recommendations will feed into our refresh of the health and wellbeing strategy as well. And then finally, we mentioned the outbreak management plan. So some of you may remember that we published the prevention and management plan back in June 2020. This was something that all councils were asked to do. The aim really was to look at how, as local systems, we were tackling COVID-19, how we would prevent outbreaks, how we would manage how we would manage and mitigate outbreaks, and how we would support different risk groups. With various things happening. So for example, the vaccines and the testing landscape changing hugely in the last few months, new variants coming out, etc. The government has asked us to update those. So we've done that over the last couple of weeks, working across all services in the council and partners. And we've received feedback on that, which has been really, really positive, especially around work on inequalities and around vaccine uptake. And we are just adding a couple of final tweaks to that, and that refresh plan will go to Cabinet later in April. So just wanted to finish off with a few key messages. I think really importantly, if anybody's talking to local communities, I think these are really key. So please, for everybody to carry on, follow those national lockdown rules, not to jump ahead to the next 1 or 2 easings of restrictions, but to really see what's happening now. And stick to it, and help protect yourselves and your families. I think importantly for people who have been in that shielding cohort, from 1st of April, you will no longer be advised to shield, but please do carry on taking extra precautions. Again, if people have got symptoms or want to get regular tests because they're out and about for work, for example, we've got the links there, and this will be published online for where people can get those tests. I think really importantly for people that, especially if they need to self-isolate with COVID, support is available, help is available, both in terms of financial support and wider wellbeing. So, for example, helping organise online shopping. And so the links there on the council website. And I think for vaccinations, I've already talked about those groups that are eligible. Don't wait to be contacted. If you're in one of those priority groups and haven't yet been for vaccination, you can go online or ring 119 and book that vaccination. And I think really importantly, even if you've had your first vaccine, there is still a chance that you might either get or spread the virus. So really important to carry on following those COVID guidelines. So washing your hands, covering your face, giving each other space, and now they've also included opening the windows and getting some fresh air in. That's all from me, Chair. Thank you very much.
Wow, that was a lot, and thank you, Anna, for giving us such a comprehensive review of everything that's happening. And obviously, I think all of us on the board are intimately acquainted with one or other of these many strands that are going on all at the same time. I don't know, Neha, if you wanted to come in to say anything about vaccination. Yvonne, you're not muted.
I wanted to ask a question, if that's possible.
You can indeed.
I've been in and out, and I've been seeing people and not seeing people, and being told I'm in 2 meetings and 1 meeting. Could I ask Anna a purely localized question? Lots of people in South Acton don't drive cars and don't want to get on public transport. Where do they go to get vaccinated?
Yeah. Thank you, Councillor Johnson. So I'll comment on this, but Neha might want to add more. So we have got a number of pharmacies dotted around the borough, and we are trying to increase those over the next few months as well. I think importantly in Acton, we've had a number of GP practices who are providing clinics. It might only be a day for now, but that might be repeated again. But I think it is an area where we are very conscious in terms of accessibility and really trying to work with local communities and local providers to run those clinics. Neha, I don't know if you want to add to that.
Yes, thank you. So as you quite rightly said, our GP practices have been running vaccination clinics within their practices for a day and taking vaccine to their practices. If any patients feel that they are in that situation, they can't get to a site for one reason or another, they should contact their GP practice in the first instance, as long as they're in that eligible criteria. There are other sites across northwest London which may be closer to an individual living in South Acton. So please, I would encourage people to go onto the national booking system or ring 119 to see the closest site first.
Point I'm making
we are working with NHS England to identify additional fixed sites, which will be pharmacy sites. And in particular, we have asked for a site in Acton. We do understand that there have been sites potentially identified and are undergoing NHSE assurance. So once those are available, we will communicate that out to patients as well, which will be closer to anyone living in Acton.
And what I'm trying to say is that people don't have cars in South Acton. There's quite a low car ownership. And so they don't want to get on public transport. I know Councillor Rye very kindly sent Acton councillors a list of the surgeries and so on. Could we be sent a very up-to-date list of where people can go? Because if we want to encourage people, could we be sent that? All the Acton councillors? So we can direct people to those sites. I'll turn myself off now, but just to say also, it would be, sorry, I'll stop now. I'll let other people come in. Sorry about that, Chair. And also there was a cat fight going on somewhere, and it wasn't my cat, so I don't know who it was. Right, thank you. I'll go off now.
Thank you. Okay. So can we do that, Neha, in terms of giving an up-to-date list of where people in Acton can go?
Yes, we will circulate the list available across Northwest London, but as I say, there won't be a site in Acton until NHS England have approved a pharmacy site, and as soon as that is available, we will let people know. But I would just ask patients, if they are in that situation, they can't get to a site and they want their vaccine, to speak to their GP in the first instance or go onto the national booking portal.
Okay, Mohini.
Can I come in on? Yeah, so I think it's really important to recognize a couple of things. Firstly, we were constrained by the type of vaccine and the delivery of vaccine. This is not the flu vaccine. It's a specialized vaccine that is given in a consolidated place. It is perfectly fine for people to go into public transport. The shielding advice on that changed a while ago, and especially it was okay for people to attend for vaccination. Secondly, from the 29th of March till the end of April, there is no availability of the first vaccine. So there isn't going to be anything new that's going to happen because of the way of the supply issues we've had. So for people who, that's why for those people, your GP practice have been contacting people once, twice, thrice, 4 times, because we are not accepting just when somebody can't attend once. Normally you try them again, a family member or somebody else can bring them. But we are, at the moment now, we are really focusing on the second doses, which need to be done as quickly as possible, so we can, then the mass vaccination sites will pick up the first doses after the end of April. So you cannot walk into a vaccination site. That is not the way the COVID vaccination one works. You have to be invited to it, and if you're eligible.
Okay, thank you, Mohini. As an Acton resident, I got my first dose at the mass vaccination centre a couple of weeks ago now. I cycled, but I was told that I couldn't get on my bike for another 15 minutes after I'd had vaccine, because otherwise, if I had a turn, I might have had an unpleasant end. And I do know we are trying everything we can to get vaccination accessibility in Acton. We've been working with Acton Mosque on Oldham Terrace to see if they can do an outreach session. We've not got the numbers there as yet. We are also exploring the possibilities of a bus. We've been offered use of a Greenwich vaccination bus. So as yet, we're still working on these things, but we are very mindful of Acton. Any other questions? And Northolt and Southall, I should add to that as well, as has been said. Any other comments or questions on what was an awful lot of information, the crux of what we've all been dealing with over the last few months?
Chair.
Yeah, go ahead, Binda.
Sorry, I don't know how to put my hand up on this device. I think it would be helpful, in view of the amount of work and the effort that's gone in, you know, by all our partners here, if we could just record our thanks for the work that's been carried out so far on COVID-19.
Yeah, absolutely. And yeah, be it the testing, the vaccinations, the surge testing for South Africa variant, so many things that have been done, and people have really put themselves out at weekends, long hours, in order to get all of this up and running. And I have to say, you know, I've had so much positive feedback from people, especially on the vaccination program. And you know, again, my own experience, it was fabulously organized and smooth and efficient and courteous and supportive, and you couldn't have asked for a better kind of service. Mohini.
I just wanted to say, actually, it was also a very good example where health and social care really worked together extremely, extremely well. And I know we're going to do the paper which went to the JOSC in March, and I can talk to that. But I think it's a real strength of our partnership in this, really. So thank you to everybody for that.
So Keith, we'll put that thanks officially on our minutes to everyone.
Yes, that's fine.
In terms of our response. So, and obviously we will continue with everything that we're doing, and keep our fingers crossed that the road out of lockdown continues as it's planned, and we don't have any kind of third wave, but that relies on everybody doing the hands, face, space and fresh air now. Okay, fine. Thank you everybody for that. Let's move on to we're not going to take item 9, Let's Go Southall. That's been deferred, so that will come back hopefully at our next Health and Wellbeing Board. Item 10, the integrated care system and the white paper and ICS briefing and the JOSC that was held in March. Are you going to lead on this one, Mohini?
Yeah, I'm happy to talk through this. Really, thank you, Chair. So just to say, this paper went to the JOSC in March, and people may be aware that there is a white paper. There was a consultation in December, January, and it is going to Parliament in May, to be debated in Parliament in May, and subject to approval would receive royal assent in January 22 to be finalized from the 1st of April. In essence, the white paper, what it includes is that ICSs, or integrated care systems, North West London is one of the integrated care system, become statutory bodies with a board that will include, as it says, NHS Trust, Foundation Trust, General Practice and local authorities. And there will be a health and social care partnership board. So I'm going to come to what we already have in place at the moment. So across London, just to give people an idea, there will be 5 ICSs, which are really, is the geography across London and similarly across the rest of the UK. What is quite interesting is that if you remember, following the 2011 Act, the responsibility for primary medical, dental, ophthalmic and community pharmacies went up to NHS England, but that will then come into the ICS because everybody recognizes that there is an element of integration between these. And primary care, as you know, we've got a delegated budget, delegated to the CCGs in any case. And this is literally, well, today's what, 30th. Tomorrow is the last day of Ealing CCG. As you know, we have merged into a single CCG. So where have we got to so far? We already have a Health and Local Government Partnership Board, which is chaired by Penny Dash. And in tandem with that, we are working on borough-based partnerships, and we have a borough director in Ealing, and that is Sarah Rushton. I know she can't be there today, but it's very much about health, social care. And in health, I include primary medical, community mental health, community services, working alongside our local government colleagues. And we had the first, well, we had an ICP last week. And we've got a set of priorities which have been delivered through our integrated working. Alongside this, there is a development of primary care networks, which are really a combination, a consolidation, group of GP practices working together along with their other provider colleagues, which is community mental health, community services with social care as well. What this paper also talks about is that it moves away from the commissioner-provider split, which was one of the big issues in the 2011 Act, and the whole focus on procurement takes a really back seat. In terms of oversight, that comes into the ICS, and we're currently working through the governance of that. So as I mentioned earlier, Ealing has a very good way of working, a history of working across health and social care. We've demonstrated that in many ways, and especially during the COVID. So I think, and as you know, the single CCG has been formed and goes into operation from the 1st of April. Similarly, the providers are working together to align the way they work together so we get the best outputs and the best healthcare for our residents. I'm going to pause there. And then subject to parliamentary approval, ICS becomes statutory bodies from April 22. And happy to take any questions, but what we know on this is fairly limited and is in the paper.
Sure. And I think we should put on record our thanks to you, Mahini, because obviously, and congratulate you as well in terms of thanking you for all the work that you've done as chair of the Ealing CCG, but also congratulating you on now chairing the North West London ICP. So we are glad that Ealing has got you at the table, but obviously we've got that representation through myself and Paul Nasarik as our chief executive as well at that North West London level too. And I think we'll come on to some of those questions from members of the public later to explain our kind of thinking and how that's going to work as well.
Thank you very much. But it's been a pleasure working in Ealing and a pleasure working with yourself and with all the team. So I cannot thank people enough.
And also to congratulate Dr. Taylor, who is going to take over from GP perspective in Ealing going forward to work alongside Neha. So we're delighted that Dr. Taylor's going to be working closely with us as well. So look forward to that. Any questions or comments on this? Judith.
Yeah, thank you, Julian. Absolutely agree with everything you say about Mahini's leadership of the CCG, and we're fortunate to have Vijay moving into that role, and Neha and colleagues as our local borough support. The ICP has been reinvigorated. We started the ICP and then COVID took place. So we'll bring our refreshed draft priorities to the next Health and Wellbeing Board so we can engage the Health and Wellbeing Board on our proposed priorities and then next course of action for going forward. Thank you.
Thank you, Judith. I can't see any other hands or anybody waving at me on their cameras either.
Oh,
go on, Binder.
Well,
you want to come in?
Yeah, I just wanted to, say a huge thank you to Mahini for all the work that she's done, and I do welcome Vijay and look forward to working with him. And I think of particular significance has been the recognition of the work that we need to try and eradicate inequalities in health. So thank you so much for that, and I look forward to continuing with that agenda with Mahini and with Vijay in the future. So thank you.
Thanks, Binder. Any other comments? I can't see any hands at the moment. If not, let's move on to our next item, which is our work program. And we've kind of suspended our normal way that we do the work program because we're essentially responding to COVID, and the kind of agenda has written itself, really. I'm mindful of what Anna said in her presentation about us as we go forward, integrating everything that's happened with COVID into the strategic needs assessment, and obviously that will happen, and we'll bring that back at some point in the future. But is there I think we're due to meet in June, I think is the next time we meet. So is there anything for that meeting that we need to be particularly cognizant of? Anna and then Judith.
Yeah, thank you, Julian. I think the work that Anna's described will definitely come back at that point, and we could expect the ICP a description of the partnership arrangements and our priorities as a major item of discussion. Thank you. And hopefully Let's Go Southall will be in a position to share what we're anticipating might be positive news from Sport England about an investment in the Let's Go Southall project.
Yep, Anna.
Thank you, Chair. I think it's just that item on integrated impact assessment will have done a lot. There'll be a lot from the last update, both in terms of things like economic impact, for example, but also all the community engagement work around it as well. So we can bring that as a substantive item. Thank you.
Okay. So hopefully, Keith, you've got all that, and we can add those to our agenda for next meeting. Yvonne, I've got your hand up. Did you mean to put your hand up? You're muted at the moment.
Sorry, am I unmuted now?
I can hear you now. Yeah.
Oh, good. I was going to say on the last thing, Mahini told us that it was all going to happen in April, and I'm pleased that she's going to be representing us because I know how hard she's worked over the years, and yourself and Paul. So will there be, for example, I know we don't know the details because she said it's got to go to Parliament. So will we have, say, 3 or 4 people from each of the other health authorities, the old ones? Or do we not know yet?
Did I?
Yeah, go ahead, Maggie.
Yeah, so it'll be all the look. So you've got 8 boroughs in Northwest London. All 4 are on the partnership board, and I know Leslie as the chief exec of the ICS, along with Joe Olson and Carolyn Regan, meet leaders of the council and the chief execs on a regular basis, and there's a regular JOSC where they present. So I think that will continue, but it'll be the 8 boroughs, and they will be sitting on the partnership board.
Thank you. Thank you.
Okay, thank you. I think that covers that item. So our final item is questions from members of the public, and let me just
Julian, can I just say one thing before you
go ahead, Mahini.
Could you just minute from me that a big thank you to everybody. This is my last Health and Wellbeing board, and it has been an absolute privilege and pleasure to work in Ealing across the system. And I think we've grown in leaps and bounds. And I think there's a real opportunity for health and social care to work together at a population level across the economy. So and thank you so much for all your support and your work from everybody, really. So I just want, if you could just minute that for me, please. Thank you.
Absolutely. And Keith, we're minuting our thanks to Mahini as well for her work, and our congratulations in her new role, and welcoming VJ as well. Fine. Okay, so first question is from Roy Willis, Chair of Ealing Reclaimed Social Care Action Group. Roy.
Hello, can you hear me?
We can indeed. Go ahead.
Okay, thank you. Thank you, Chair. We've got a couple of questions, perhaps from the public health and social care point of view. First question is relates to what are the latest statistics regarding vaccinations of workers in care homes? Despite the extensive efforts to counter vaccine hesitancy, we understand that as of the 14th of March, only 63% of care home workers have been vaccinated. And I think today, from the report from Anna Bryden, that's gone up to 65%. I think we're still a bit disappointed that is not higher, and looking at whether there's any further actions that can be taken to increase that.
Okay, who what? Kerry, you've got your hand up. We're struggling, Kerry, with your. We can't hear you. You might want to turn your camera off and That might free your bandwidth up a bit.
Thank you, Chair. Thank you for the question.
We're struggling. We're struggling to hear you.
Slight improvement.
Yeah, we're not picking you up. Perhaps Judith can answer. We can't hear you, Kerry.
Yeah, I can come in, Kerry. Thank you. So thanks, Roy. This is an area of concern for us. So we're pleased to say that as of the 22nd of March, 65% of our care home workforce have received their first vaccination. We're continuing to push on that agenda and encourage people to come forward. So thank you for that question. Roy also asked a question about domiciliary care, which is the same subject. If you wouldn't mind, Chair, I'll answer that question at the same time.
I can. Yeah. Do you want me to put that question as well?
Right, Roy.
Yeah. Okay. The situation seems slightly worse in domiciliary care when only 47% of staff had been vaccinated as of 14th of March, and obviously domiciliary care agencies are scattered throughout the borough, and there's also the personal assistant groups of workers looking after people on direct payment. So we are concerned about the figures here again. So again, I understand from Anna's report that it's now 50% of the staff have been vaccinated. But I think we'd like to ask if there's any further actions that can be taken, communication, organization, whatever, that we can look to try and increase this amount, this percentage of staff.
Thank you, Roy. And Julian, if you're happy for me to respond on our behalf, it's now 51% of home carers have received their first vaccination. So we're pleased that we're continuing to make progress, but it's not substantial enough to properly protect the community. So this is a priority for us. We're engaging with the domiciliary care market, so the organisers of those services, as well as the individuals directly. We've put on individual sessions in terms of vaccine hesitancy, and we'll continue to do that. It's really important for our community that we protect the most vulnerable through protecting the workforce who support them. So that will remain a priority for both ourselves and the NHS colleagues.
Thank you, Judith. Ivano, you've got your hand up. Is that an old hand? I think it must be. Roy, why don't you ask your third question, please?
Okay, thank you. The third question is, when a national inquiry is established into learning from COVID and its impact on NHS social care provision and working arrangements between the different parties involved, what lessons will Ealing have learnt and be able to contribute to the national discussion? And obviously that's to do with what we've learned in terms of hospital discharge policies, close working relationships between health and social care, and perhaps other issues relating to the overuse of do not resuscitate notices. So there's a whole range of issues, some of which have been raised before by us and by the committee, in the committee. So I was wondering if there's any general points could be made around this in preparation for any national inquiry, which there are hints that will be set up at some point. Thank you.
Thanks, Roy. Judith, do you want to kick off?
Yeah, I'll kick off because I think there are a number of strengths. One naturally responds thinking that we have only negatives to contribute to national discussion on such an issue, but actually there are lots of strengths in the way that Ealing have responded to the pandemic. So just to kick off on a few, and then my NHS colleagues might wish to join in. Ealing as a sector led on the development of the designated sites Mary Robinson unit. So we were delighted that West London NHS Trust progressed that. And that was the first site nationally to support the capacity to divert patients with a COVID positive diagnosis and to prevent them being discharged back into a care home. So that was a really strong piece of partnership working. As you all know, Ealing also led on the procurement of PPE for North West London, and then that was rolled out across the whole of London through our West London Alliance and commissioning arrangements. So that was, again, a success. I think our Ealing Gold arrangements have been strong, and that's been, we met bi-weekly and spoke as many times as we needed to make sure that the decisions were right in our response to COVID. And that's a strong model that can sustain. We've had also a really strong care home cell as part of our Gold arrangements, with representations from local partners, CQC, provider reps, and Public Health England since late April. And that's provided real oversight of the care market and supported provider decision-making around closures where there have been outbreaks. We were undoubtedly ahead of the game when it came to closing, supporting care homes to close early. And just lastly, as a comment, we worked closely with the daycare providers to ensure that they were financially supported and could sustain when they were closed, and then help them in terms of securing when opening. So a few reflections from me that we would have many positive things to share to any future inquiry.
And Mohini, did you want to come in as well?
Yeah, I did actually. Couple of things in addition to what Judith said, from a health perspective, what Northwest London did, and we were unique actually. This didn't have the rest of London. We also set up our COVID hubs, so people who had a positive diagnosis of or symptoms of COVID, right? This was started in April at the end of the first wave and then carried through summer and really escalated in the second wave. We were able to look after people in the community, both with remote monitoring and with telephone monitoring. We were able to support the London Ambulance Service, because of people may remember how busy the acute system was in Simon on the call, how busy it was in December, January. And we were able to take calls from 111 and people who attended ED but who didn't need to be admitted could be seen in the COVID hub. So there was a really joined up response, and we were also doing testing at the time. And as Judith said, we were really having bi-weekly calls to make sure that we could support the acute system as much as possible, because everybody recognized the pressure and the work that was happening there, and to support people in discharge to have clean pathways across the piece. So even when we were taking people out, we could manage them in a safe pathway. And I know the work Chris and West London did in this right through the COVID pandemic.
Thank you, Mohini.
Julian?
So,
Chair, are you happy for me to say? Yeah,
Simon, of course. Okay.
So apologies for my fiascos earlier on around connecting to this call.
You're here.
Yeah, one of my
here, and we can see you.
Yeah, indeed. I'm here now. Anyway, so what I would say is, from an acute perspective, I think there were quite a number of things that we did between Northwick Park and Ealing in terms of one of the first doing the sort of lateral flow testing of patients, so getting early indication of whether they're potentially positive or not, and separating the pathways in terms of how we treated them. I think we're also one of the first in terms of the different drug regimes, in terms of treating those patients differently, that gave them a better chance of survival. And we certainly massively increased our critical care and HDU capacity at pace in terms of being able to respond. So there are a number of things that we did from an acute perspective within the hospital to respond. I think the other thing is to pay an absolute tribute in terms of the support we have had from the discharges, because without that, then we would not have had that flow through the NE and being able to bring patients who were more acutely unwell than those we were trying to discharge. And I know that presented some challenges for families and relatives on times where we were discharging patients not necessarily to where they wanted to go or as close to where they wanted to go, but safety of patients was the most important thing. It's not just their loved one that they were we were thinking about is the patient waiting to come in and access a bed and to move out and get access to the right treatment as well. So I think as a system, we worked extremely well in terms of supporting that flow, and that was a 7-day-a-week service. It worked on Saturdays and Sundays in the same way it did Mondays and Tuesdays. So that was really fantastic, and the challenge is to sustain some of that going forward. You mentioned a comment about do not resuscitate. Those decisions are not taken lightly in any shape or form, and those have to be signed off by the medical team in doing it. Wherever they can, they're speaking to the families about it. Again, as a result of COVID, some of that's been more difficult, where the relatives couldn't actually see the patient or be in the hospital and have that direct discussion. So I do understand that there has been some dissatisfaction with some of those decision making and the process involved in it, but all of those are taken clearly in the best interest of the patient, and indeed in terms of their presentation in terms. So that is always done in the clinical decision basis, and those are reviewed internally. But I do understand that there has been some challenges for families in terms of that, because they haven't necessarily been able to see the patient and have that face-to-face discussion with the clinical staff involved.
Thank you, Simon. I've got VJ Taylor next.
Yeah, I just wanted to also just reflect on the general practice's response to the COVID pandemic, particularly around the way that they had to deliver care from the traditional face-to-face method of working by using technologies like video consultations, e-consult, email consultations, as well as telephone consultations. So, you know, general practice had to respond to the pandemic and had to really try to adapt very, very quickly. In fact, you know, within a matter of weeks of the first lockdown being announced in March last year, practices had to restructure how the staff were working, and also had to restructure how they continue to manage patients' care, particularly in relation to, you know, the acute urgency needs of patients during the pandemic. So I think that was a lesson learned, and that has actually been very, very positive, particularly for practices and also for patients as well, in terms of the turnaround response of their needs by using remote access.
Thank you. Mohini, did you want to come back in again?
I just wanted to actually really, the acute system, the community and the providers, mental health providers, the way people work, the mutual aid, was actually absolutely phenomenal. And I think people should not underestimate the amount of effort people did and the amount of work that went and the amount of help across the system to keep people safe.
Thank you. And Neha?
Thank you. And I think there's a real recognition that watching the teams work, and whether they were administrators or volunteers or frontline health professionals, everyone just rolled up their sleeves and did whatever was necessary at that time. And I think it was just incredible to watch. But as you asked anybody to do anything, everyone was just willing. Doesn't matter which setting of care you were in, and the relationships with the local authority and the support that they provided, including for the vaccination program as well, was just incredible. And I think this type of a crisis just brought out the best in everybody.
Thank you, Neha. I'm going to go out onto my doorstep and start clapping, I think, at this point, because yeah, it was extraordinary, and yeah, we certainly, as we've kind of highlighted, done some kind of things that were national firsts as well. So people should be very proud, I think. Okay, I think that covers that question, and that's all your questions, Roy, covered. So I've got Eve Turner from Ealing Save Our NHS. Got your name right?
You have. May I just say that even before we, since you talked about the white paper, that the integration of everybody working together seems to have taken place without the need to reorganise the NHS and have centralised services and ICSs and all the rest of it. So you've got to expect that I'm going to make a comment like that, because it did seem to me that that did happen. So my question actually is really to the council, I think, which was that during the formal consultation on the single CCG, Ealing and Hammersmith and Fulham and other councils did express some concerns, considerable concerns about local authority representation and the loss of a local voice to ensure that health needs of local people would still be addressed. And my question is, what concerns does the council now have about a North West London CCG and or a North West London ICS? So anyway, so I suppose that's one for you, Julian, and any others. So
yeah, so let me kick off and then I might bring Binder in as well. So I think the council's pleased that following lobbying that we as a borough have got a borough-based team, rather than at one stage it was kind of envisaged that we might be sharing arrangements with a neighbouring local authority. Hounslow was mooted, and you know, there was a risk that would have diffused the local partnerships that we've been talking about, how positive and strong they've been tonight. And I think we were really worried that we may lose that, but we've kept that borough-based team. So I think that has allayed significantly some of our original concerns, and as I've said, we've seen and we've talked about it all night, the real strength in terms of local NHS and council partnership working throughout the last year in particular, and obviously we want that to continue. We also expect to influence and lead the direction of the North West London agenda through the ICP and the Health and Wellbeing Board. And as we've talked about, we have representation of all of the 8 boroughs, including myself as leader and Paul Nasarik as chief executive at that North West London level. So that's certainly something that we would see as a change as we negotiated and talked all of that through in the last year. And again, we've had regular meetings over the last year, which have kind of given us a level of comfort that you know, we will be able to make our voice heard. We've worked closely with our local and North West London NHS colleagues on the vaccination rollout. And again, I think that's an illustration of that successful collaboration, not just at borough level, but at North West London level. And it does feel as if that we have been working as a partnership. Our expectation for North West London ICS is that they will level up the investment in health across the 8 boroughs and address inequalities for our residents. And that will be obviously one of our ongoing priorities. And again, I speak for all of the borough leaders, actually, we've all, and chief execs, we've all talked about the kind of funding challenges and leveling up rather than down. And finally, we're pleased that Mohini's been elected as interim chair of North West London ICS governing body. So again, that we will use our connections and long-standing working with Mahini to feed in any concerns that we have, and we're delighted again that, as we've said, that VJ Taylor is a very able successor of Mahini as clinical lead and chair of the local CCG. So I think it's fair to say that we did have considerable concerns, Eve, but we've it's not perfect, and we'll have to see. We'll keep it all under review as we go forward, but it feels much more of a partnership, I have to say, and that we do have a real seat at the table, so our concerns are much less. I don't know, Binder, if you want to add to that.
No, I agree with everything that you've said. The only other thing I would add is that we have managed to influence how we work, and we will continue to do that in the best interest of our residents. And I think as long as our voice is being heard and we're able to make the changes, then the system will continue to work well.
You're going to have to forgive me for not sharing your optimism, but of course time will tell. I mean, a couple of things that make me feel less optimistic is that the North West London CCGs I've just seen is only going to meet once a quarter, which is less than it used to before. But I was slightly surprised to hear that you said that there was representatives from each of the local authorities on the North West London CCG, because that's not what it looked like on the piece of paper, that, unless I misheard you, Julian. Are you saying that there are 16 representatives?
No, I'm talking about the ICS rather than the CCG, because there's 2 reps on the North West London CCG. But for the ICS, then there's all borough leaders and chief execs.
Are on the ICS, is that on the main?
Can I just make a correction, please, that I'm not chair of the ICS, I'm just chair of the North
West London CCG.
Chair of the ICS is Penny Dash.
Penny Dash, I know.
Sorry, I'm giving you too much responsibility, Mahini.
Yeah, I need to retire.
Okay.
I won't labour it. I think people probably know my position on this, but anyway, which I share with other campaigns. But obviously, we will see. Perhaps it makes sense to skip to my last question, because it was about the borough meetings and it kind of would flow from it, which was, I've read what I can as to see how the borough committees are going to work and how the integrated care partnerships are going to work. And obviously that's been raised today, but I haven't seen very much about how they're going to work. And I haven't seen anything about whether or not those bodies will meet in public in any way, and whether there'll be any sort of access, any papers published or anything else, in the same way that the North West London CCGs. And as members of the public, we want to find ways, particularly as campaigns, in which we can hear what's happening, feed in and put, obviously express the views of our campaigners and the communities that we work in. And I wonder if there is any further information. There isn't anything on the latest paper that's come out about how this will work and how there will be any kind of meetings in public or any kind of public accountability. So I wonder if anybody can update me on that.
Okay, I've got Judith, your hands up, and VJ.
Yeah, just me. I think we'll use in the first instance the Health and Wellbeing Board as our public accountability. So we'll be bringing regular reports and papers and decisions here. We'll be evolving the ICP, but obviously, as we've talked about this evening, we've been busy with COVID-related matters. So we'll be bringing back both our terms of reference structures and what we intend to do over the coming years back to this next meeting, so that you can have that scrutiny and oversight. We all agree that scrutiny.
Lost it.
Yeah, well, you're breaking up, Judith. You've done a carry on us. We can't hear you. But I think we got the gist of that. VJ, did you want to add to that?
Yeah, I just wanted to just add on that now I realise that it's really, really important that we maintain a strong borough team in Ealing, and we continue the progression of all the collaborative working that we've done up until now as Ealing CCG, and we are currently working through the organisation in terms of the local committees or committees that we would require to make sure that we're able to fulfil our functions locally. But I think that our two main vehicles locally are going to be the our ICP particularly, and we had a very productive meeting last Friday, and it really did feel that we are starting to make progress. We've got obviously a lot of work still to do in terms of the priorities of ICS, but also the local priorities for us in Ealing, so that we have got a lot of work to do over the next 12 to 18 months. And we will, in terms of the public engagement, like Judith says, at the moment we have the Health and Wellbeing Board. The ICP, our ICP, local ICP, is not a statutory body. At the moment, our public engagement in terms of the single CCG is our single North West London CCG, where the meetings will be held in public. But I think we will make progress locally when we potentially become the statutory ICS next year. Our ICP function may also change from a statutory perspective as well. We'll just have to wait and see, and then that will progress even further in terms of the public engagement. So it's just about just give us time. We're just finding our feet at the moment, trying to discover how the borough team will work and fit in with the single CCG. Yes, but I'm confident that now and I will make sure that Ealing's and Ealing's requirements and its needs, as well as the inequalities, are addressed in the best way we possibly can.
Well, we shall wait and see. But obviously, being able to engage with people goes a long way when you're a campaign. If you can't actually talk to people or raise points, it becomes quite frustrating. But anyway, thanks very much for answers to that. I've just got a couple of other questions, one of which I might be probably put into the for North West London, and I don't know if people can answer this, which is really about commissioning of services, because there's a couple of points, something I read and I wanted some clarifications. It's really about whether all NHS services are going to be commissioned at the North West London level from April 2021. And if that's not the case, then which services would be commissioned either at a different level, such as the local level? Because I read something that slightly confused me. So just trying to understand whether everything is going to be done at the North West London level, or whether there'll still be some commissioning at the local level. So I don't know if somebody can answer that question.
Yeah, Mahini, you've got your hand up.
Mahini,
yeah, just to say that we have been commissioning across North West London for a very long time now, and that's the way we work. We've had a North West London financial strategy, and what will be different going forward is the lens on inequalities and how we deal with it, as Councillor Bell mentioned earlier. But we've always done that. Similarly with mental health, for our acute mental health services, we have got a mental health strategy and a group which meets to make sure that we are the service that we are providing to a North West London resident is irrespective of postcode. There is a journey to get there. I don't think it's equal for all parts of the system, and similarly for so there's going to be no change to our community services, because most of us are doing that within our borough, and primary care enhanced services again will increasingly be such that we have a North West London offer, addressing, of course, whatever North West London commissions is based on the needs of the population across the 8 boroughs. It cannot say it's separate from it.
Just to clarify, are you saying that it will be a move towards everything being commissioned at the Northwest London level and nothing being commissioned locally?
We've always had it like this. It's been like this for many years. So we've had some community and some primary care services being commissioned. That will continue to happen locally, but increasingly what we're looking at even in primary care and general practice is the enhanced services are commissioned in such a way that we have the same offer for residents across Northwest London. And our community services, as Chris and Joe are both on the call, is really an integrated service. I don't see any change in that happening in the near future. So, yeah.
Thanks, Vinny. And then your final question.
There's joint commissioning which will continue to happen locally, as it always has done.
Okay. Well, my last question is about money, because that's been talked about, and about whether or not there's going to be a levelling up, which is what Julian is hoping for. But at the recent Northwest London Josh, which I listened to, I mean, unless I've got this wrong, there was some talk about the deficit for the whole of Northwest London being £200 million. And if I've got that wrong, then that's fine. And it was mentioned by the officers, and it was also talked about the need to balance the book, because the requirement is now from the government is to balance the books. And I just was quite concerned as to how this could be done, because 200 million does sound like quite a lot of money, without harming some local services. And very often it has been the acute trust that, because they're the largest expenditure, have tended to bear the brunt of some of that. So I wonder if there's any reflections on that, and how that might affect your plans. So that's my final question. Thanks.
So should I start to answer that?
Go ahead.
So, yes,
yeah.
I don't think the acutes have borne the brunt. I think the brunt's been both across community and mental health, and I've got community mental health colleagues in the room as well who will say, and actually we've got a mental health investment standard which ensures that we do not we raise the bar for mental health commissioning, and not just commissioning but spend across the boroughs. But just going back to the thing, yes, it looks like we may well be in a deficit of 200 million, but Simon, you might be able to help me there. The financial regime for the NHS is going to be the same for Q1 and possibly Q2. I can't remember what that is, but there will need to be. So I think the financial challenge isn't going to go away.
Yeah, I'd just echo that, Mahini, in terms of it's still early days in terms of working out what the financial envelope looks like for Q1 and Q2, and what the expenditure plans look like. So the first cut, I think, is as you say, the indication of about £200 million. But I think there's further work to be done in terms of clarifying exactly what funding is coming in to the Northwest London ICS system still, so there may still be some movement on that, but also in terms of trying to aggregate everybody's expenditure plans. I think there's some check and challenge in terms of, is that all has that been put together as robustly as it might be, and so there might be some reduction as a result of A, additional income coming in, and B, some of that check and challenge. But inevitably there will be some financial discipline required going forward, and that there's not the same level of flexibility anticipated for all of this financial year in the same way that we had in the current year.
Okay, thank you, Simon. So thank you, Eve. And that brings us to the end of our meeting, other than to say that our next meeting will take place on the 23rd of June, 2 days after the 21st. And I don't know whether that means we could actually meet in person. If the lockdown happens, the roadmap out of lockdown happens as it's meant to happen. I have to say I'm probably in the skeptic camp on whether or not we'll be out of this by the 21st of June, but we can only hope, and continue to get your vaccine messages out, and follow the rules, and you never know, we might just, when we next meet, be free of COVID restrictions. But thank you very much, everybody, and have a good rest of the evening.
Thank you.
Thank you, Chair.
Thank you.